The most honest answer, I think, is that there's a multiplicity of dietary patterns that are conducive to human health.
What are your thoughts about something like the carnivore diet that's predominantly animal protein based?
I think that what we're witnessing with this community is one of the greatest, and I don't mean that necessarily in a positive light, but I mean widespread experiments with human health that I don't think over time will turn out well. So I can't say that I, in good conscience, could ever promote that kind of diet to anyone based on what we know about nutrition. Yeah, so low carbohydrate diets have a place, certainly in diabetes management. How that carbohydrate restriction is achieved and what replaces the reduction of carbohydrate in the diet are important determinants to the potential health effects of that diet. The ketogenic diet is a clinical nutrition diet. Its origins are in clinical nutrition going back to the 1920s. So I think a really important characteristic for people, I've never any issue with someone that wants to kind of adopt a low carbohydrate diet to try and achieve better glycemic control if they're pre-diabetic, for example. I think how they set up the diet matters, but I think they should know as well that what tends to happen is the improvements in their glycemic control are only a reflection of the fact that they have restricted exogenous carbohydrate intake. There's no underlying improvement in the metabolic physiology, which is what a lot of the proponents of the diet argue there is, and we don't have evidence that there is. As soon as carbohydrates are reintroduced, they'll basically be back to the same level of kind of glucose intolerance as they were when they started, unless substantial weight loss has occurred, which can occur on low carbohydrate diets. So I do think there's a place for them. I think they need to be done correctly.
Well, Dr. Alan Flanagan, you're very welcome to the podcast today. You are an expert in evidence-based nutrition. What do you believe to be the healthiest diet that humans can engage with?
I think if we were to answer that in a way that's very detached from the kind of ideological bunkers that the diet world can find itself in, the most honest answer, I think, is that there's a multiplicity of dietary patterns that are conducive to human health. As a species, humans have pretty much settled every nook and cranny across the globe, different climates, different food access related to those climates. Certainly historically, we've a much more homogenized, globalized food system now. So the diet that most people might eat in Ireland might look quite similar to a diet someone's eating in LA or, Edinburgh. So that's a kind of more contemporary feature of our food environment. But ultimately, what we have generally is a way that we could describe health-promoting dietary patterns in terms of their characteristics. Generally, those are diets that are more enriched in unsaturated relative to saturated fats. They're high in dietary fiber. They contain a lot of contributions from non-starchy vegetables and fruit of a variety of colors, and the color is not accidental. The pigmentation of fruits and vegetables gives them non-nutritional compounds, but these compounds appear to be quite important in promoting health. So polyphenol compounds and otherwise, they're very bioactive. They're just not nutrients, micronutrients in the classic sense, so we don't require them for life. And so when we kind of start to nail those characteristics of a healthy diet down, the actual food-based ways that people achieve that is less relevant. And that's why we can compare a traditional Japanese diet to a kind of Mediterranean diet to a diet in, the Baltic region, and we can identify similar characteristics that all relate to the health promoting qualities of that diet. So I tend to try and think of it in those kind of broad terms, which hopefully makes it a little more accessible for people and kind of decharges or depolarizes some of the real kind of crazy stuff we see online.
Well, speaking of which, because you mentioned a great word there, bunkers, dietary bunkers, I suppose silos would be another term for it. I've interviewed many different people who espouse different diets on this particular podcast with interest, because I tend to ascribe to a generalized omnivorous diet, to be quite honest. So I interview these people with fascination, and I spoke with Dr Carnivore, who is a proponent, especially online, of the carnivore approach, and any of his followers tend to be very fervent in extolling the virtues of their experience of this carnivore approach. What are your thoughts about something like the carnivore diet that's predominantly animal protein based?
Yeah, and exclusively almost animal flesh based. I know there's various iterations of it where they might include eggs, but it's very much a diet that seems to be highly kind of oriented around consuming red meat in particular, in relatively kind of copious amounts. Little to zero intake of vegetables, fruits, and otherwise. And I think that what we're witnessing with this community is one of the greatest, and I don't mean that necessarily in a positive light, but I mean widespread experiments with human health that I don't think over time will turn out well. I find it very difficult based on current knowledge and evidence that we can take some of these kind of incontrovertible truths about what characteristics of a health promoting diet exist, such as fruit and vegetable intake. Whether someone consumes steak or not on top of that is a different story. But the idea that we would take some of these pillars of what we know and turn them on their head, in such an extreme way. And I've heard the kind of positive stories. I've heard the glowing reviews of someone with irritable bowel syndrome who really couldn't find any symptom resolution and was struggling to identify why they kept getting triggered and experiencing very unpleasant symptoms, who suddenly goes on a diet like this, which in that context constitutes an extreme elimination diet. They are literally narrowing down their food intake to a food that we know to be relatively hypoallergenic, and they're consuming just that food as their staple. So I'm not surprised I hear these stories sometimes of short-term symptom resolution. What that community are not particularly good at showing is the people that also have stories of having a triple heart bypass after 4 years on the diet because they had a 90% blockage in their coronary artery. So they're very good at highlighting all of the success stories, and they're not particularly good at highlighting people who have had and run into very serious health complications as a result of that. So again, like I said, it's just one giant experiment. The nature of the relationship between diet and disease or health outcomes is that it's the cumulative effect over time of relatively low doses of an exposure. And so what that means is that, and I think this is kind of somewhat overplayed often in the carnivore community as well, someone's been on this diet for 3 years and they've shown, okay, well, that's typically not the time frame in which we would see any relationship with some of the kind of major lifestyle diseases that we would see. So I think overall, I think it's a risk factor as a diet. I think it's very difficult to see how that wouldn't add up if someone did manage to sustain it for a decade. For example, I find it very difficult to see how that won't have a cumulative toll on their health eventually, and the toll will probably have to be paid at some point. So I can't say that I, in good conscience, could ever promote that kind of diet to anyone based on what we know about nutrition.
What about a low carbohydrate approach? I've spoken to many doctors who would espouse that approach, particularly as far as managing a patient's diabetes or their weight is concerned.
Yeah, so low carbohydrate diets have a place, certainly in diabetes management. How that carbohydrate restriction is achieved and what replaces the reduction of carbohydrate in the diet are important determinants to the potential health effects of that diet. So often you see when people are lowering their carbohydrate intake, for example, there's this kind of concomitant increase in a lot of, animal source saturated fat. That's not necessarily ideal. What you can often see there in that kind of context, if someone's looking to manage, and improve their HbA1c as a kind of glucose regulation marker, is that their HbA1c might come under better control, but their LDL cholesterol goes up. So they're just trading one risk factor for another. It doesn't particularly make sense from a health management perspective. So that generally reflects the kind of setup of the diet. It's not deterministic that a low carb diet will necessarily have that effect. So I think that a low carbohydrate diet that still manages to preserve a minimum amount of fiber in it and predominantly emphasize unsaturated fats from plant and marine sources has a place in diabetes management, but in terms of the underlying metabolic effects, the kind of proponents of low carb diets are still somewhat arguing, for the existence of something that's never quite shown up in the research. They talk about all of these kind of quite far-reaching metabolic benefits, and then, when pushed as to why, a lot of the controlled studies and research that's really tested very low carbohydrate diets against normal carbohydrate intake diets, haven't really shown up these kind of fantastic benefits. There's always a kind of, well, that's science fault because we know this to be true anyway, which I don't really think is a very scientific way of thinking about things. So, for example, we're told that there's these enormous glycemic improvements. They're not that huge. Like, if you compare standard carbohydrate diets to kind of lower carbohydrate diets, you'll certainly see generally quite a significant improvement in HbA1c over 0 to 3 months. Over 6 months, that starts to kind of attenuate, and over 1 year, that tends to wash out entirely. So it can be quite useful for short-term metabolic control, but there appears to be the benefit to it is only proportional to the time the carbohydrate restriction is sustained. And a lot of people just can't really sustain that over time. So I think a really important characteristic for people, I've never any issue with someone that wants to kind of adopt a low carbohydrate diet to try and achieve better glycemic control if they're pre-diabetic, for example. I think how they set up the diet matters, but I think they should know as well that what tends to happen is the improvements in their glycemic control are only a reflection of the fact that they have restricted exogenous carbohydrate intake. There's no underlying improvement in the metabolic physiology, which is what a lot of the proponents of the diet argue there is, and we don't have evidence that there is. As soon as carbohydrates are reintroduced, they'll basically be back to the same level of kind of glucose intolerance as they were when they started, unless substantial weight loss has occurred, which can occur on low carbohydrate diets. So I do think there's a place for them. I think they need to be done correctly, but a lot of the kind of fanciful claims of their metabolic benefits aren't really, supported by good evidence yet.
And then that leads me naturally then from the low carbohydrate approach to the ketogenic approach. People have ascribed to this particular diet, again, for their regulation of blood sugar levels and also their weight. But I know, having spoken to Dr. Dom D'Agostino and to Professor Thomas Seyfried, they would be of the mind that the ketogenic approach can be used in a therapeutic context, particularly in respect of cancer treatment. I know you've been critical of elements of this in the past. I want to ask you if there's any room at all for the ketogenic therapeutic approach as part of a larger clinical approach to treating cancer.
So for cancer at this point, I'd have to say no. I mean, the ketogenic diet is a clinical nutrition diet. Its origins are in clinical nutrition going back to the 1920s, and it remains a clinical nutrition dietary intervention, specifically in the context of drug-refractory epilepsy, where it does have efficacy. And that's always been its kind of established clinical use. The purported benefits from a cancer perspective relate to the kind of unique physiology of ketosis as a physiological state, but they center on the premise that cancer is driven by what's known as the Warburg effect, which is that there can be cell growth essentially and proliferation in the context of glucose, feeding off glucose. And the idea then is that by depriving cancer cells of glucose and shifting into a stage of physiological and metabolic ketosis, that will kind of be drowned off essentially as a source, that you're kind of inhibiting this glycolysis-mediated kind of promotion of tumor growth. There is some fascinating rodent studies on this. There's some interesting mechanistic potential support, but it falls down, I think, on a couple of levels. One is that it assumes that the Warburg effect is the only real avenue metabolically through which proliferation in cancer is driven, which is not the case. Each cancer site, depending on, and this is the problem with cancer as an umbrella term, is it assumes, pancreatic cancer is metabolically and physiologically the exact same as, kind of breast cancer, and that's just not the case. So we're talking about an umbrella term where the Warburg effect can be particularly influential in about 20 to 30% of cancers. It is present in all of them, but in terms of this kind of primary driving metabolic pathway. And then I think more than anything, the limited human evidence that does exist is also employing very low calorie ketogenic diet. So not only is it the ketogenic kind of setup as a diet, some of the interventions in humans, and they're mostly limited to kind of case studies, very small kind of hypothesis generating research, have been interesting, but they've also been, I remember a couple of studies where the actual energy intake was 600 to 800 calories a day. So this is indistinguishable then from the effects of severe energy restriction and potentially kind of fasting, where there's also some kind of interesting stuff going on in humans in relation to cancer. But again, we're very far off any sort of conclusions. So the ketogenic diet has always been one of these things that I think has this interesting metabolic physiology. It has nowhere near the kind of outcome data in humans that we would base recommendations for cancer treatment off. And I think the mechanistic proposal as to why it would be beneficial in cancer is not something that is necessarily applicable across all cancers. And so I find it very difficult to kind of make any broad claims or recommendations in relation to cancer treatment, which, for the most part as well, there's concerns over, muscle wasting, cachexia and stuff. And so the nutritional needs of cancer don't seem to, in my opinion, kind of lend themselves at this point to, very low energy ketogenic diets. So yeah, it's a tab that needs to be, I think, and will be probably left open for now to see if it could be beneficial adjuvant to chemotherapy. I think that's an important stress point as well. The studies, the limited research that does exist in humans hasn't just used the ketogenic diet as a monotherapy, it's used it as adjuvant to standard radio and chemotherapy. Is there room for it? The short answer is, I don't know. There's some suggestive research there. There's nothing of the type of quality of research that we need to kind of make the conclusions that I think that a lot of people that are very pro-ketogenic diets leap straight from mechanisms to assume that this translates to some sort of benefit in humans. And that's just not how we actually should be thinking about using evidence to inform practice.
Some experts have pointed their finger at the mitochondria and have suggested that it's mitochondrial dysfunction which is contributing to cancer being a disease of metabolic dysfunction. I'm presuming then you wouldn't agree with this.
I mean, it's a disease of multiple dysfunctions. This is the problem, I think, when people try and say cancer is a disease of metabolic origin. Well, it's also a disease of genetic origin, of genotype. So it's a disease of phenotype, environmental exposure origin. It's a disease that combines a multiplicity of these predisposing factors, environmental exposures, etc. So there is a metabolic component to cancer, but the idea that makes it a metabolic disease in and of itself as a kind of source, I think is, to me, demonstrates probably not a particularly strong understanding of cancer. And when I see a lot of these claims, I can't help but notice that it often comes from people that aren't necessarily in oncology.
You mentioned saturated fat earlier on. I had a really interesting discussion with a journalist, you probably know her, Nina Teicholz, who wrote the book, The Big Fat Surprise, about a year or so ago. And she was critical of how the food industry in particular had promoted high carbohydrate at the expense of fat. And essentially what's happened now is that we have low-fat foods and we have a high sugar in all forms of foods today. So I'm just wondering what your thoughts are in respect of the perception of fat, how that has evolved down through the years, because remembering back to the 80s and the 90s, everything was low-fat back then. And it seemed to me to be that, and the consensus was that saturated fat and fat in general was demonized. Now, I know not all fats are healthy. The trans fats, for example, in North America, they're banned here in Europe. What are your thoughts in respect of saturated fat in particular, and then how best should we be consuming fats?
So I think often what creeps into discussions about nutrition generally, diet, nutrition and health, is a tendency to kind of conflate the food industry and the way the industry conducts itself with the actual evidence pertaining to an underlying kind of recommendation, whether it's a public health recommendation or otherwise. And I think that's very much the case with fat. I mean, yes, the food industry pushed, a very kind of low-fat kind of product-based marketing, particularly evident in the 1980s. It did push, sugar. You can go back and there's 7-Up ads from the 1950s where it's a baby drinking a 7-Up. But to kind of get too caught up on that assumes that there was, some sort of kind of agenda from the scientific angle. And I've looked back over the literature of kind of the emerging heart disease was the particular focus in the early post-Second War period. And it's very difficult to sustain that there is that kind of, kind of nefarious aspect to the research that was being done at the time. There was a lot of really highly controlled research that pointed the finger more at a role for saturated fat in the context of very high total fat diets that were being consumed in industrialized countries, particularly in the post-Second World War period. And the evidence from effects of kind of sugar at the time wasn't necessarily that convincing. So there's a number of reasons for this. So I think that the first, just to kind of, I suppose, go down the saturated fat lane and then kind of circle back to sugar, is we now have a pretty comprehensive body of evidence showing that elevated levels of cholesterol in the blood, particularly in LDL cholesterol, is causal of atherosclerosis and then cardiovascular disease events and mortality related to that atherosclerosis. We had very, very tightly controlled studies going back to the 1950s, updated periodically over time, a pool of evidence that's now over 400 metabolic ward studies, the tightest level of control we can have in nutrition, manipulating the different types of fat in the diet that very clearly show that saturated fats have twice the cholesterol raising effect as the cholesterol lowering effect of unsaturated fats. So that evidence formed the basis of our public health recommendations around fat. And that evidence is, as I said, based on voluminous amounts of research that we now have over 70 years. There's a contention then that, well, even if that's the case, there isn't really that much of a clear relationship between lowering saturated fat and lowering cardiovascular disease risk. There is, it's just slightly more difficult to tease out in more recent population-based studies because saturated fat intake has come down a lot. But if we go back to periods where in the kind of 50s, 60s, and into the 70s, dietary saturated fat intake could be up around 18, 19, 20, 21, 22% of total daily energy intake. There's much clearer signal in the noise in favor of that relationship. And we know from intervention trials where people consuming high levels of saturated fat that replaced that with unsaturated fats, polyunsaturated fats in particular, on average, have a 30% lower coronary heart disease risk. So the saturated fat aspect to this whole picture, I think, it warrants its place in our public health advice. But to be fair to people that look back at the kind of 60s and 70s and say, why wasn't there much of an emphasis on added sugar at that point in time? There's a couple of factors I think play into it. One is that the actual content of sugar as a percentage of energy intake hasn't really changed that much, but the sources of sugar have. So in the 60s, most people are consuming sugar in the home in the form of, jam on toast, essentially. That shifts to added sugars in the food supply in a major way. The research at the time looking at metabolic effects of sugar very clearly showed that the relationship between sugar and kind of adverse effects on risk factors like triglycerides or otherwise was mediated by energy intake. When we don't overconsume energy, even with diets that contain 20, 25% sugar, we don't tend to see those adverse effects, whereas you can see those effects of saturated fat of LDL cholesterol in the context of just consuming maintenance levels of energy. And then if you fast forward over the last 30 years, we've seen dramatic intakes in average population energy levels. depending on the estimations, if you look at some US data, an average of 600 calories a day more being consumed compared to, say, the early 70s. So we've seen this dramatic increase in energy intake. Within that, added sugars have gone up as well. And I think the two of them, those additive factors, explain some of the negative health effects that we see with sugar in modern population diets. But I think, idea that we started eating low-fat diets and replaced it with sugar is just really unsupported by any convincing evidence. If we look at the proportion of macronutrients in the diet, in the UK, I haven't really seen Irish data on this, but certainly in the US, and generally, like I said, with more homogenous food systems, Western industrialized countries tend to be relatively similar on this point. No one started eating low fat. An average fat intake in the UK, when guidelines were enacted, dietary guidelines were enacted in the late 70s and early 80s, was around 40% of energy, 38% to 40%. It's really only in the last few years come down to about 35%. Like, a low-fat diet would generally be classified as under 30% of energy. There's just no one started just eating that diet at a population level. So I think that's one thing to kind of pinpoint. This narrative that we suddenly started eating low-fat diets and replaced it with sugar. As a proportion of energy, sugar hasn't changed that much, except for in more extreme corners of the population who consume a lot of added sugar. Saturated fat came down, and that coming down did bring total fat down, but still only in the realm of about 4 to 5% of total daily energy intake. So these are not dramatic numbers. And more fundamentally, it's this kind of argument that this recommendation to lower total fat, lower saturated fat, and consume, and people started consuming more sugar, is based off our dietary guidelines. The guidelines that came out in the late 70s and early 80s were very clear that added sugars should be reduced and that carbohydrates should primarily be whole grains and vegetables and fruit. And we have multiple analyses now in different populations showing that the greater that there is adherence to those guidelines, the lower all-cause mortality risk, cardiovascular risk, diabetes risk. So the idea that the guidelines themselves are kind of responsible for this ill health pandemic we have in populations in Western industrialized countries just really isn't supported, I think, by good evidence overall.
Just on that, what do you think are the main factors that are contributing to that ill health pandemic? You did mention excess calorie consumption and added sugars. So on top of that, what else do you think it might be?
Well, we did have the trans fat issue for a while, which you brought up, which I think is a really good example of, a very deleterious component of the food supply. And thankfully, research caught up with that, and either it's been removed from the food supply by mandatory regulation in the case of some states in America, or in the UK, for example, it's now less than 1% of food energy through partnership with industry. Overall, I think if we're going to look at the primary drivers of this over, say, the last 30 years from a nutrition perspective, and I emphasize that because this doesn't exist in a silo. Like, diet is not the sole reason that we have, these issues at a population level. There's enormous issues, with psychosocial stress and, various other factors that play into, cardiovascular risk, etc. From a dietary perspective, I think overall, the shift to a very energy-dense, energy-rich diet that was relatively kind of poor in nutritional quality is a major factor. Substantial increases in overall total daily energy intake, where the quality of that energy intake is very poor. I think that really just points it out as the primary driver. It's the kind of, if you hear hoofbeats, first think of horses rather than zebras. And then within that, I don't necessarily think that any specific macronutrient is itself to blame within the context of a diet that is that kind of energy dense, energy rich, and the foods themselves. I think really this comes back to food rather than a specific kind of macronutrient, or even rather than a specific culprit food within that. I think the type of dietary pattern, and we kind of opened this conversation by saying a multiplicity of dietary patterns can be conducive to human health when they follow certain characteristics. From a disease risk perspective, I think we can really kind of say that there's certainly a dietary pattern that has the opposite effect to health promoting diets. And it generally now in nutrition research is known as the standard Western diet or the Western diet. This dietary pattern is high in energy, is very low in fruits and vegetables. I think it's characterized from a disease risk more by what's present, by what is present, certainly, but also by what is not present. It's a very low fiber diet. It's a diet that's not, particularly rich in good fats. It's low in omega-3. It's low in unsaturated fats generally. It's typically high in salt. Sodium's probably one of the biggest drivers globally, not even in Western countries, of cardiovascular risk. And it's a diet that, in terms of the foods themselves, and the kind of characteristics of the food environment, is then characterized by being energy dense, energy rich, nutrient poor. And I think all of that just kind of adds up in the context of wider environmental factors that also influence, an individual's kind of health over their lifespan.
Courtesy of the internet, there's just such a massive information out there now. It seems to be more easy than ever to get your hands on information, and not necessarily information of good quality. So for the audience, how do they parse that information? How do they enhance quality control as far as getting the right advice is concerned? Because research is published all the time, and it's not always of good quality, as you know.
This is the question that I've been asked this so many times on various podcasts, and I still don't really have that good an answer for it. Like, in the information age, how does someone, let's just take someone who's never had a social media account, and tomorrow they set up Twitter, X, and Instagram, and TikTok, and they're interested in their health, not just diet. They're interested in multiple aspects to their health: diet, exercise, sleep, etc. They're walking into a minefield in which they cannot possibly win. The algorithm is going to, foresee a scenario where, if they set those accounts up tomorrow, by Sunday night, they're doing all sorts of weird and wonderful things, opted some farcically extreme diet, and are doing various kind of wild behaviors for the rest of it. The short answer is, I really don't know. I mean, there's a few things that I think I would come to or offer someone that doesn't have domain specific knowledge or expertise in an area, so they're kind of relying on the way that people hold themselves out. One is, I do think that within nutrition, given everything that we know, extremes on either side. We've talked about the kind of carnivore kind of end of that spectrum, but I've also seen people recommending, diets, vegan diets with about 7% total fat. That's an extreme at the other end of the spectrum, for which there is additionally no good evidence really to support why someone would do that. So I think if you're finding the extremes, that's, I think, an amber light. Generally, if people discuss diet or evidence in absolutes, most people that are kind of more scientifically minded or trained will communicate very much in the language of may, could. There's very few kind of absolutes. That's not a style of communication. If someone's saying, this is what you have to do, this food is toxic, this food is an elixir, that kind of certainty and absolutism should also be a real amber light or red flag. And then I think pay attention to how people actually, because everyone talks about research nowadays, like you said, there's research published all the time, but everyone's also always talking about it. I think the manner in which someone discusses research and evidence is important, and everyone can say studies show, but not necessarily everyone can then take someone and actually show them why a study shows what they say it does. And that's the difference to me. And that's my litmus test. And I would always say to people, even if you've never come across nutrition research in your life, you really don't have to be an expert to ask questions. And questions themselves to the source of information that you're receiving, especially online, can be quite instructive. As in, how someone responds to being questioned, in my opinion, is very instructive of their bona fides in many respects. And if they respond defensively or dismissively, that to me is a red flag, and has always been, because if anyone is really worth their salt and is trying to communicate good nutrition science and evidence-based information online, and you ask a question, they will take the time to show you why, what they're saying is supported by, some research, and they won't just fob you off, dismiss you, throw you a link to a PubMed, ID or something like that. So yeah, I don't know. Hopefully they might be useful to listeners, but the short answer is it's a minefield out there, and I think people are probably better off just spending less time online, if I'm honest.
Well, I know you're a busy man. Before I let you go, could you tell me how people can get in contact with you or find out more about some of the work that you're doing online?
Yeah, so the only real social media platform that I'm active on is Instagram. So people can find me at The Nutritional Advocate, all one word. I run a education platform largely for nutrition and medical professionals, which is based on research review. We have a weekly research review of a recent study in nutrition, and that's Alinea Nutrition. And then they can also find me with Danny Lennon on the Sigma Nutrition podcast, and we have pretty frequent podcasts coming out on various topics in nutrition there as well.
And I will link all of those in the show notes of this episode. I really enjoyed our chat today. Dr. Alan Flanagan, thank you so much for your time. Really appreciate it.
Thanks, Matthew. Thanks for having me.
Well, thank you for tuning into this episode of the Happy Habit podcast. If you enjoyed it, show your support. Like, subscribe, and share news of this podcast with other people. Plus, we're on YouTube if you want to head over there and become a subscriber there too. Until next time, stay happy.